everyone, Dr. Shakib here. Today we're tackling a topic that a lot of people with hypermobility might not even realize is connective, digestive issues. It may be bloating, IBS, or even GERD, which can be surprisingly common if you have hypermobility syndrome. So in this video, we're going to break it all down. Why these issues happen, how they're related to connective tissue dysfunction, and what you can do to start feeling better. Remember, I'm not a gastroenterologist, but these things are common. We're not learning in schools about hypermobility, connective tissue disorders, and so we providers learn from our patients, and what I'm sharing with you today is all about what I have learned. What digestive issues are commonly associated with hypermobility syndrome? Let's start with the basic. That is 100% basic. People with hypermobility syndrome often deal with things like IBS, irritable bowel syndrome. This can show up as bloating, cramping, diarrhea, or constipation. Gastroesophageal reflux disease, or GERD, which that burning sensation that you get after eating. Gastroparesis, which is basically a delay in stomach emptying. Chronic constipation or diarrhea, sometimes alternating between the two. These symptoms can really affect your quality of life, and they're more common in people with hypermobility than you think. Now, how does connective tissue dysfunction contribute to problems like IBS or GERD? Here's the thing. Connective tissue is everywhere in your body, including your digestive system. When it doesn't work properly, like in hypermobility syndrome, it can lead to weakened support for the digestive tract. This can make things like acid reflux or bloating worse. Dysautonomia or POTS, which is when the autonomic nervous system, which controls things like digestion, doesn't function properly. Slow or irregular bowel movements, and finally, in conditions like EDS, Ehlers, danlos syndrome, the digestive system can become a little too flexible, if you will, leading to structural and functional issues. For example, if your lower esophageal sphincter, the muscle that keeps stomach acid where it belongs, gets too loose, you're more likely to deal with GERD. This takes us to the third question. What dietary and lifestyle adjustments can help manage digestive issues in hypermobility? The good news is there are a lot of ways to manage these issues. Eat smaller, more frequent meals. This helps reduce that strain on your digestive system. Focus on fiber, but go slow. Too much fiber too fast can actually make things worse. Of course, if you have conditions that fiber is an issue, you got to keep that in mind. Stay hydrated. This is key for preventing constipation and dealing with dysautonomia. Elevate the head of your bed for GERD. Sleeping at a slight incline can work wonders. What I say is don't put your pillow the way you would use your pillow. Put it in a vertical way, and then put another pillow there just to elevate it a little bit. Probiotics and gut-friendly foods are helpful. Think yogurt, kefir, and fermented veggies like sauerkraut. Once again, this all depends on you. If you have issues with it, don't take it. Of course, movement is so important. Gentle exercises like walking or developmental exercises like DNS, dynamic neuromuscular stabilization, are so important, and they're so easy on the joints and bodies. These are what took us from not being able to do much of anything as an infant to become that running toddler stage. That can help stimulate, these things can stimulate digestion and support your overall gut health. This takes us to the last question. When should someone with hypermobility seek medical advice for digestive concerns? While many digestive issues can be managed at home, there's some red flags you should not ignore. Things like severe persistent abdominal pain, unexplained weight loss, blood in your stool, and difficulty swallowing. If you're dealing with any of these symptoms, or if your digestive issues are just getting in the way of your life, you gotta see a doctor or a specialist. They can help you rule out more serious conditions and create a treatment plan tailored for you. Remember, seeing a specialist that treats EDS or hypermobility is super important. The next option is a provider that's willing to learn. You can visit my website, hypermobilitytherapy.com, for some of the providers that I refer my patients to, and make sure you vet them yourself so you see a good fit for your needs. On the same website, hypermobilitytherapy.com, you can see a blog I did on treating hypermobility on a budget and what I think would be a good guideline to follow. You can also visit EDS Society provider list for a provider near you. Hopefully there is one. There you have it. Digestive issues and hypermobility are more connected than you might think, but with the right approach, you can take back that control. If you found this video helpful, please be sure to like, subscribe, and share it with anyone who might benefit from it. And if you've got questions or topics you'd like me to cover in a future video, drop them in the comments below. Thanks for watching, and I'll see you next time.